Good morning to everyone, to Abdiel, to the sign language interpreter, and to all people tuned in every morning. Our country reports today 1,186 hospitalized patients, 36 under medical supervision, 626 are suspects, and 524 are confirmed active cases. Yesterday, 4,294 samples were processed at the molecular biology laboratories of our country. At the Tropical Medicine Institute Pedro Coury, 1,135. At the Provincial Center of Hygiene, Epidemiology and Microbiology of Villa Clara, 847. At Havana, 669. At Santiago de Cuba, 281. At the Genetic Engineering and Biotechnology Center, 553. At Hermanos Amejeira's Hospital, 408. At the laboratories of the Civil Defense, 212. Also yesterday, the Molecular Biology Laboratory of Fructuoso Rodriguez Hospital managed to process 109 samples, and the Molecular Engineering Center, 80 samples. As you may notice, there's been an increase of the institutions that analyze collected samples. In the next few days, other laboratories will carry out this task as well in order to raise the number of processed samples. As a result of these 4,294 collected samples, 44 people tested positive for COVID-19. Thus, we accumulate 336,333 processed samples, and 3,408 people have been diagnosed with COVID-19, which represents 1.01% of all processed samples. We always emphasize Cuba's vigilant attitude. Hence, every province managed to analyze samples. Pinar del Rio province processed 105 samples. Artemisa, which has shown an epidemiological complexity in the last weeks, processed 463. The highest figure of samples was analyzed in Havana province with 2,644. Villa Clara, a good number, 564. Holguín, 216. Ciego de Ávila, 86, and so forth in every Cuban territory. The 44 diagnosed cases are Cuban, 40 are confirmed case contacts. That is, the 84.1% of all confirmed cases in Cuba have been confirmed case contacts. The source of infection of 4 of the new cases diagnosed yesterday is yet to be determined, for a cumulative of 217 people and the 6.4% of all diagnosed cases. None of the patients diagnosed yesterday reported their source of infection abroad, so the cumulative of 318 people remains unchanged. Of the 44 positive cases, 23 are male, for the 50.1%, and 21 are female, that is the 49.9% of all confirmed cases in Cuba. 22 patients were asymptomatic, that is 57.3% of all diagnosed cases thus far. If we review the last 15 days, the result is slightly higher and highlights one of the main characteristics of the disease, which tends to show statistics above 50%. There have been even instances where 60 and 70% of the diagnosed cases have not presented any symptoms at the moment of the test. 3 individuals are under the age of 20. 20 belong to the 20 to 40 age group, 14 to the 41 to 60 age group, and 7 patients exceed 60 years of age. We're not specifying the cumulative of children or individuals under the age of 20 because we're conducting an analysis along with the pediatric center, since they considered as minors patients up to 18 years of age. So tomorrow we'll provide a detailed figure of confirmed and discharged patients belonging to this age group. However, we can assure that more than the 85% of confirmed cases in pediatric ages are currently discharged and present a clinically stable evolution. 36 of the 44 diagnosed cases belong to Havana province, 6 to Artemisa province, and Villa Clara and Las Tunas provinces report 1 case each. In Artemisa province, 4 cases are from Mariel municipality, 1 from Artemisa and 1 from Alquizar municipality. The diagnosed person from Villa Clara belongs to Santa Clara municipality, although this patient is linked to the event detected in Camajuaní municipality. In Las Tunas province, the patient is reported as a contact of a previously confirmed case and is from Las Tunas municipality as well. In Havana province, of the 36 cases, 7 are from Marianao, 5 from Boyeros, 4 from Playa, 4 from La Lisa, 3 from Plaza de la Revolución, 2 from Centro Habana, 2 from San Miguel, 2 from Habana del Este, 2 from Habana Vieja, 2 from Cerro, and Arroyo Naranjo, 10 de Octubre, and Cotorro municipalities reported 1 case each. Hence, Havana province shows a significant spread of the virus, so we call on everyone to comply with the protection measures, considering the high risk it entails regarding its behavior and the percentage of asymptomatic cases. Hence, the rate of infections per 100,000 inhabitants rises to 5.66. Artemisa province rate is 21.95, which is lower than the previous day but still a considerable rate. Havana also increases its rate up to 22.48, Villa Clara rises to 3.6, and Pinar del Rio maintains its rate of 1.03, Las Tunas 0.56, Matanzas 0.28, and Mayabeque and Holguín provinces 0.26 and 0.1 respectively. I repeat, Havana has the highest rate of infections in the country, followed by Artemisa province. Summarizing, of the 3,408 diagnosed patients in Cuba, 524 are confirmed active cases, which is the 15.4%. 516, that is the 98.5%, present a clinically stable evolution. We have not reported any fatalities in 14 days, for a mortality rate of 2.58%. We always mention the 2 evacuated patients at the beginning of the pandemic. Yesterday, 102 patients were discharged, a convenient indicator which, compared to the amount of confirmed cases, shows a favorable relation between discharged and hospitalized patients. Enough been asked, how are these results possible if so far we have reported 1 or 2-digit numbers of discharged people? Well, this outcome is mainly due to the amount of positive cases in the last 10 days. When someone is diagnosed with a disease, that person is hospitalized, tested again on the 9th day. If the results are negative, the patient can be discharged on the 10th day. With this behavior, we accumulate 2,794 recovered people, which is the 82% of all diagnosed cases in Cuba. 3 patients are in critical conditions, 5 in serious conditions, all of them from Havana province and hospitalized in Havana's hospitals. 1 positive patient is reported now in serious condition, and 1 patient yesterday reported as critical is currently in serious condition. Likewise, 2 other patients previously in serious conditions are currently under medical supervision. Summarizing, as for today, we report 3 patients in critical conditions and 5 in serious conditions admitted in the ICUs, where the treatment protocols that have prevented our country from reporting any fatalities in the last 14 days are being properly applied. For the global outlook, up to 12 o'clock last night, the same 185 countries remain to diagnose COVID-19 cases. 217,262 people were diagnosed yesterday, for a cumulative of 21,689,832 infections. 4,193 people died yesterday, which amounts 760,263 fatalities. That implies a mortality rate of 3.55%. The region of the Americas reports nearly the 54% of worldwide diagnosed cases, since it confirmed 108,517 people with the disease only yesterday and accumulates 11,698,368 confirmed cases. 2,206 people died yesterday for a cumulative of 420,753 fatalities and a mortality rate of 3.6%. We would like to show a chart created by the World Health Organization that shows COVID-19 worldwide behavior and its increase on a daily basis up to August 16th. The chart reflects that far from decreasing, the lines continue to rise. The yellow color indicates the behavior of the pandemic in the Americas region as the epicenter of the disease. The green color represents Europe and how it showed higher figures at the beginning of the pandemic and has been regularly decreasing, although it maintains significant figures of infection. The blue color depicts Southeast Asia, followed by Africa, and the lower part of the chart shows the Eastern Mediterranean behavior of the disease. It's important to remark the evolution of the pandemic in the Americas region. In countries such as the United States, with 5,403,269 infections, Brazil with 3,340,197, Peru 535,946, Mexico 522,162, Colombia 468,332, and Chile 385,946. And precisely these figures lead the Americas region to be the epicenter of the pandemic. The following map reflects the behavior of the disease in the world, the total amount of confirmed cases per country. We're able to see the United States, the Americas region in general, and Europe. The World Health Organization wants to highlight the situation in the African continent, since there have been more COVID-19 related deaths than the ones caused by Ebola disease. Coronavirus pandemic accumulates 11,959 fatalities, in opposition to the 11,308 deaths by Ebola disease between 2014 and 2016. So this is the report on the situation of Cuba and the rest of the world.